So the concept that these four artificial discs are doing anything but acting just as a four-level fusion is obviously ridiculous. As you can see here, this is very similar to what we see with lots of patients who get ADRs. There's very little motion here in these disc spaces at all in flexion. And there's zero motion in these disc spaces in extension. So this is basically a four-level fusion pretending to be an artificial disc. And that's what the research shows in ADRs. They're no better than fusion. Was a great concept. It just doesn't really work for most patients practically. So now this patient has adjacent segment disease with upper cervical symptoms. So this is a set of artificial discs that have created a brand new problem.